Jennifer Lush, and I am a community family physician who is privileged to live and work on the traditional territories of the Wasanich people, and that is in Victoria, BC. And I have been a family doctor for 21 years.
My name is Tina Koronik. I work at the Northeast Community Health Centre with my family medicine practice and at the University of Alberta. I've been in practice for about 18 years.
My name is Sean Groves. I am a rural family physician from La Ronge, Saskatchewan, and I joined the practice here in 2005, and this is my 18th year in practice.
Well, my name is Grant Goldberg. I'm a family physician at Access Fort Garry in Winnipeg, which is a primary care centre where I work for the Winnipeg Regional Health Authority. And I have been in practice for 28 years.
I'm Dr. Danielle Burns-Shreves. I've been a family physician for 11 years and currently serve as the Executive Medical Director at Restore Medical Clinics in Ottawa.
Bonjour, je m'appelle Isabelle Gosselin. Je suis médecin de famille depuis 25 ans. Je travaille actuellement au groupe de médecine de famille, un GMF universitaire à Saint-Hubert.
Alors, mon nom est Lise Babin. Je suis médecin de famille à Dieppe, au Nouveau-Brunswick. J'ai commencé à pratiquer en 1996, donc 27 ans.
My name is Emmanuel Bamikole Adjuo. I'm a family doctor based in New Waterford, in Cape Breton, Nova Scotia, and I've been in practice for the last 23 years.
I'm Padraig Casey. I'm a family physician in Cornwall, Prince Edward Island, and I've been a family doctor for about 8 years.
My name's Dr. Jim Bowen. Graduated from Ottawa in '85, and I've been practicing for, I think, 37 years.
My name is Stephanie Buchanan. I'm a family physician working in Whitehorse, Yukon. I work in my own clinic with a group of physicians. I work in the hospital, and I also work in a rural community in the Yukon as well.
It's an incredible honor and profoundly humbling, as the nomination is coming from my mentors and colleagues, people I look up to and have the greatest respect for, and I feel the work of each family doctor in Canada is worthy of similar recognition and celebration.
To be recognized this way by my peers has just been extraordinarily humbling. I would say I really was surprised by the nomination, and it inspires me to live up to what the nomination suggests.
Well, I think as a rural family physician, I really try to, as much as possible, to embrace the concept of truly broad spectrum generalist practice. I really look forward to a time in the near future where family physicians are really able to reclaim the central role in providing oversight, expertise, and extremely high-quality medical care that's required both of us and of the healthcare system in general.
Là, c'est sûr que j'aime de croire que je suis disponible pour mes patients quand ils ont besoin de soins. J'espère que je suis à l'écoute puis que je réussis à bien supporter mes patients aussi. J'ai eu un rôle à la direction d'un programme de formation en médecine de famille c'est nous qui aidait à former les futurs médecins de famille de la province du Nouveau-Brunswick. Fait que j'ose croire que avec notre équipe, on a réussi à former des médecins ils ont été formés ici au Nouveau-Brunswick puis ils ont revenu travailler au Nouveau-Brunswick. Fait que d'avoir été capable de répondre à ce besoin.
I really believe that primary care is the hub of our system, and it allows us to look at physical, mental health, psychosocial needs, and I really feel that we play a huge role in making sure that patients do not fall through the cracks and avoiding sort of fragmentation of care.
And I realized that the job of family medicine would offer me the opportunity to live where I wanted. I could live rural, I could truly live anywhere, and I would have a meaningful job that would sort of fit a lot of the qualities that I really didn't know I had at the time. But, being a generalist, being curious, being pretty trustworthy, if I sign up for something, I'm going to do it. And I think it all just seemed to fit.
grande question. Je pense que quand on finit cours de médecine, je sortais du cégep, donc j'étais assez jeune. Je pense pour les mêmes raisons qu'un peu tout le monde, la diversité de la clientèle, puis le type de pratique. Je voulais faire un petit peu de la pratique hospitalière, un petit peu de bureau. Donc, c'est sûr que mes choix sont plus clairs pour la médecine de famille, puis c'est pas les mêmes options, mais c'était beaucoup ça. Puis je pense que je me trouvais dans la bonne spécialité pour moi.
My number one advice is always remember to care for yourself. As you care for others, don't forget you. A happy and healthy family physician provides, excellent patient-centered care. I'd also want to advise future family docs, just to remember that your work is valuable. You're uniquely positioned to make a difference, not just at the individual level, but even as an advocate in community and beyond. And finally, just a reminder that, this is lifelong learning. It's required for specialty. That's how we remain clinically relevant as experts.
Seeking the membership of an appropriate organization like the college to actually continue learning and having a mentor and reflecting on your own practices are some of the very important advices that I think any student resident should take very seriously in order for them to excel and succeed in this specialty.
But thinking back kind of into my first few years of practice, I got to work with a physician named Dr. Betty Spooner. She's now retired, but definitely someone who embodied most of what I think it means to be a great physician. She really led by example. She had an incredible work ethic. She had very high clinical expectations for herself, but also for the people around her. And she had a true passion and curiosity for her patients and for medical care in general. She was someone who was constantly asking questions, constantly seeking the opinions of others, and I think really embodied what good, humble but confident physicians can do as role models and teachers.
The last sentence he made to me when I finished and passed all my exams, he said, "Emmanuel, don't cut corners. I approach all my patients with dignity and with respect." And those are the values that I learned from Dr. Jawed Khan, and I'm very thankful and very grateful that our path really crossed.
I try always to engage in an effective, mutually respectful relationship with all my patients. I strive to be a skilled clinician, but also acknowledge there are answers I will not have, and to have the humility to seek answers when I do not know them. And I see one of my strongest roles as an advocate for my patients, helping them navigate the challenges of our current and often dysfunctional healthcare system.
Throughout my workday, and that, in general, life is a tragic comedy, and even in the midst of suffering and misery, there's always some light at the end of the tunnel, and there's always a joke to be made somewhere. So I just try to see the lightness in the days, and that gets me through.
Je dirais que j'apprécie beaucoup le travail de collaboration en médecine. J'ai cette chance-là de travailler dans un milieu où il y a beaucoup de collaboration. Puis je pense qu'avec la situation du système de santé actuellement, je pense que ça va être essentiel.
Well, it's kind of a pat answer, I guess, but I mean, literally my patients. I think that it's probably somehow deeply embedded in my DNA that I do want to help people, and it makes me feel happy and satisfied, and sometimes even thrilled to feel that I've been able to make a difference. So ultimately that is for sure the driver behind the whole thing.
I see the value of continuity. I've been super lucky to have had a family practice this whole 20 years, so I know my patients very, very well.
The purpose behind looking after people has changed the same, how we do it, and the science has marched forward.
In terms of the principles, I guess building relationships and trust with patients, there's a huge important principle that I follow. It's important to listen for understanding, being empathetic, and really respecting, as I said, where people are on their sort of spectrum of change, and trying to understand where they're at, and really keeping those lines of communication open is key to being able to serve our patient population.